this unit, we're talking about mobilizing and using a walker to mobilize our patients and falls risk. Before I mobilize my patients, there's a few things I need to check. One of those is to make sure that they're neurologically intact. They don't have any dizziness, headaches, their vital signs are stable. I also want to make sure they have non-slid socks or good footwear. I also want to check the physio assessment notes. You can see on the wall there that physio has assessed your patient in terms of the mobility, and they have assessed that they are one-person assist with a two-wheel walker. This is a typical two-wheel walker. Another thing I want to check is to make sure that there's no clutter in the room and there's no risk for them hitting anything. And then we can get the patient from the bed, sitting up into the side of the bed and dangling their feet to make sure they're not dizzy or have any headaches or they don't have any orthostatic hypotension. And then what you can do to encourage your patients is to educate them in terms of how to use the walker. So one of the things I do is I tell my patients never to grab the walker and lift up and start walking, because this can go flying and there's a risk of them falling. I tell my patients to boost themselves up kind of using their upper arm strength. So I get them to boost themselves up from the bed with their arms, and then they can grab the walker. Okay. Another thing I want to tell my patients is to kind of not walk far from the walker. What they should be doing is walking in towards the walker and then pushing the walker out, and then walking in towards the walker and pushing the walker out, okay? And continuing that kind of pattern versus walking kind of far away from the walker. It's a higher risk for them falling, okay? And this patient, you can see, is a one-person standby assist. So then as a nurse, you can stand by the patient to make sure they're not gonna fall and assess them and continue to ask how they're doing while they're walking, okay? So that's the things that I would do.
We're going to show you a transfer to a commode with a patient that has left-sided weakness. So this patient just had a stroke, and their whole left side is a lot weaker than their right. So things that I want to make sure that I'm doing is making sure I have a transfer belt around the patient. This just gives me support. I can hold them, get a good hold on them and support them on their weak side. So we tie this around the patient's waist. I'm going to make sure it's nice and snug, but not too snug. You don't want to hurt them. So your patient has left-sided weakness. So you want to be on the patient's weak side, and you want the patient to be leading with their strong side. So also you want to make sure that the commode or anything that you're bringing to them is on the patient's strong side. So I'm going to support the patient as they come up. I'm going to put my leg in between their legs, and on the count of 3, we're going to get up, and I'm going to pivot them, making sure that I'm supporting that side to the commode. Okay? On the count of 3, you might want to get the patient to lean forward, and then on the count of 3, we're going to get up. 1, 2, 3, up, and I'm supporting this side, and then I'm pivoting and making sure that the patient safely. And that is getting a patient with left-sided weakness to a commode.
With seeing lifts, you don't want to work by yourself. This is always a 2-person procedure. So get another nurse, or you and your instructor and the nurse can work with this. So this patient needs to go for an x-ray, abdominal x-ray, and they are immobile and needs to be put on a sling. And as you can see here, this is a typical full body sling.
The patient will be lying flat in this one.
Mm-hmm.
You also want to look at your lift. There's always a docking station where it is where we have one is on the wall, but I know at Surrey Memorial and other hospitals, their docking station just goes on as soon as you put it into the corner of the room. It's usually shared between 2 beds, so it can go from this bed to that bed.
And most health authorities are a no lift policy. You have to use a sitting lift only to lift your patients up. Okay, so we're going to show you how to prepare the patient for the lift. So you want to make sure you bring the bed up to a good working height for you and your partner. This is a typical sling that you'll see in your unit. Might be a different color depending where you are.
You're going to get the patient lying flat if they're able to.
Okay. You can bring the rails down. And so I just kind of eyeball. So this is the back of the sling where the label is here.
You want this white thread to be in line with the patient's spine. So I'm going to get Mr. Jones here to move to the side.
And I'm going to tuck the sling underneath. And just make sure you eyeball that center line.
You want to get it up a little bit higher, making sure that the head is in the sling, because you don't want their head dangling out.
Okay, so the patient can now come over to my side. Coming over to me now.
Okay.
Back onto their back.
You always want to explain the procedure to your patient too, so that they're not scared.
And then this is the remote control to bring your ceiling lift down. You can pull this over.
This thing is quite heavy, so make sure it's not swaying because it could actually harm your patient.
And just keep in mind, every ceiling lift has a maximum kilogram weight. Make sure you know your patient's weight and you're not above the max kilogram weight. And for this one, it is 200 kilograms. And we can see Mr. Jones is not above 200 kilograms right now.
For this sling, we're actually going to have the bar this way because it's so long. If you're getting a sling that puts them in a sitting position, you're going to use it this way. So anything that Tina does on that side, I'm going to do on this side. Because this is flat and your torso area is quite heavy, I like to put it on the red one so it's slightly up, but because of the weight of the torso, it will kind of even itself out.
So red. And then for the red as well.
Sure. So we're going to put 3 at the top and 3 at the bottom, making sure that this little clip is actually clipped so nothing falls out.
A little lower, right? Okay, so I'm going to just show you guys what it looks like for your patients. Okay, so we've got all sides of the sling attached to the sling lift. We've got the remote control, making sure your patient is still okay laying down like that, getting all the extremities into the sling, making sure nothing's dangling out.
Let Mr. Jones know that we're going to go up.
Okay, so now we're going to go up.
See how it goes on a little bit of an angle because the torso is a little bit heavier, so that's why you put it up a little bit.
So now that you have your patient up, this is where you want to make sure your stretcher is available. You have your stretcher or chair that is available right next to the bed.
You don't want them dangling in the air while you go grab your equipment.
Exactly. So you can move this down or to the side.
This is great too if a patient is quite obese and you can't boost them up in bed. You could use this as a way to get them up in bed. That's right. Without hurting yourself.
So since we're here, we'll boost Mr. Jones up into bed and place him back down.
Making sure it's had a nicely placed so that we're not having to move him once we get him into bed.
Yeah. Another thing you can do is place pillows underneath while the patient is up as well. So keep going up. Now we're going to go down. Okay. So then now we can
remove this thing. I'll do that side. I'll do this one. And then we never leave the sling underneath the patient because that's just going to cause a lot of pressure. We don't like to leave anything behind the patient. So we're going to remove this. Get the Patient comfortable in bed. We're done.
And then you want to lift this back up and dock it and charge it back against the collar. Okay, so then now we're going to remove the sling from underneath. So I'm just maybe you can tuck yours.
Sure. The faster way is if you tuck. Sometimes you can pull it out
Yeah.
and then move the patient to the side.
So now I'm just going to pull this underneath the patient. Okay.
And get your patient to a nice